Good morning, everyone. Thank you for joining us today to discuss bone mass measurements. My name is Karen Curtis, and I am a provider outreach and education specialist here at WPS. Today, I am joined by Jennifer Boniface. Jennifer is going to help me out today by monitoring the chat for questions that you may have and also providing additional information during the presentation. I have just a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. In our list of upcoming events, there's a column titled Materials. This is where you can find a link to the PowerPoint material. I'm also going to have Jennifer add a link in the chat just in case you need to get there quickly. Our training center also contains a webpage for encore presentations. All of our webinars are recorded, and if there are no technical difficulties, we will put these recordings on our webpage. Videos are available for up to 90 days, and they can be watched on our webpage without having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we really want you to be able to receive the education that interests you. Recordings of our webinars can also be found on our YouTube channel. There they will remain until the webinar is redone or if information has changed. Later, there will be a question and answer session if time permits. I did receive a few pre-submitted questions, so I will answer those at that time. If you have questions related to today's topic, please send those in using the chat feature. If there's any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in this presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right. Let us know if you feel that there are areas where we can improve. It also allows you to give us input on what types of education you would like to see in the future. While this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. Here at WPS, we do our best to provide you with accurate, up-to-date education. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations take priority over anything presented today. We answer questions based on the facts given. So any changes to that information may change the given response. We also cannot guarantee payment for services. So if you have a claim-specific question, we do ask that you contact customer service. They can access your claim and provide you with an answer based on how your claim is processed. Lastly, I need to let you know that CMS does prohibit the recording of this webinar. We are recording the event so that it can be posted as an encore presentation. The recording will be available by next week, so if you'd like to review or share any of the material being presented today, you'll be able to find it out on our website. Today, we are going to discuss Medicare coverage for bone mass measurement services. I'm going to discuss Medicare coverage criteria, how claims should be billed to Medicare, and how to check to see if the beneficiary is eligible to receive the services. Now, the world of Medicare contains a lot of acronyms. So I've created a list of those that you will see or hear during my presentation. Many of you may be aware of most, if not all of these, but I do like to include them just in case we have someone who's new to Medicare or maybe someone who works in the field or practice where they haven't had to know what all of these mean. So if I mention an acronym that you're not familiar with, you'll have these slides for reference. This is the American Medical Association copyright notice for CPT codes. During this presentation, I provide billing information which contains CPT codes. So this notice lets you know that Medicare does not own CPT codes or their description. This is a copyright notice from the American Hospital Association National Uniform Billing Committee. This notice is required because I discuss coding that could be included on a UB04 or 837I. For this reason, I need to let you know that the American Hospital Association is not responsible for, nor were they involved in the preparation of this material or the information provided today. So now that we have gotten all of that out of the way, I am going to start with a little bit of general information. Bone mass measurement test, also known as a bone density test, is a non-invasive medical procedure used to assess the strength and density of your bones. Low levels of X-rays are used to measure the amount of calcium and minerals in the bones to estimate the bone thickness. Tests are usually performed at the spine, hip, or forearm, but can be done on other areas of the body. There are quite a few reasons why a bone density test may be performed. It can be used in early detection of osteoporosis, which is a condition in which bones become weak and brittle. Osteoporosis typically does not have any noticeable symptoms, so if it can be detected early, then treatment can begin. This test can also help determine a patient's risk for fracture. You may wonder, how can this be helpful? Well, patients who are determined to be at high risk of fractures can take steps to reduce their chances of having issues in the future. This may include being put on treatment for osteoporosis. Healthcare providers may suggest lifestyle changes, such as stopping smoking and reducing alcohol intake. Maybe they need to introduce calcium and vitamin D supplements. They may suggest that the patient keep physically active. There could be other suggestions that could help them. Falls account for about 90% of fractures in individuals with osteoporosis. So knowing that you are at a higher risk allows patients to take additional steps to help prevent falls. This could include making changes in the home, such as removing obstacles so it's easier to get around, avoiding rugs on hardwood floors, using rubber mats, or installing handlebars in bathrooms for added support. Maybe it's time to invest in some supportive shoes, or maybe use a cane or walker to help with the stability. Now, in some cases, it may be decided that the patient should be put on medication. Bone mass measurement tests can also be used to monitor treatment for osteoporosis. A medical staff is able to monitor changes in the patient's bone mineral density over time to determine whether the prescribed treatment is effectively slowing bone loss and increasing bone density. So what is Medicare's definition? Bone mass measurement means a radiological radioisotopic that meets all of the conditions listed here. And I want to stress that all of the conditions have to be met in this situation. Tests should be performed to identify a bone mass, detect bone loss, or determine bone quality. A densitometer or bone sonometer system meeting set requirements should be used. I've included links to sections of the Code of Federal Regulations where you can find additional information. The first link for Section 807 is the establishment, registration, and device listing for manufacturers and initial importers of devices. The second link for Section 814 is pre-market approval of medical devices. Also, the physician's interpretation of the results is included. So now we're going to move on and we're going to talk about actual coverage. Now, as you can see from the picture, coverage criteria is pretty specific. Going to find the information found here in the Medicare Benefit Policy Manual, which is publication 100-2, Chapter 15, Section 80.5. This picture is a link, so we are going to go out and take a look. Now, first, you'll see that the test must be ordered by a physician or qualified non-physician practitioner who is treating the beneficiary. It goes on to say that this healthcare professional should be furnishing consultation or be treating the beneficiary for a specific condition and who is going to use the results to manage that condition. Qualified non-physician practitioners for purpose of the bone mass measurement test includes physician assistants, nurse practitioners, clinical nurse specialists, and certified nurse midwives. The test should be performed under the appropriate level of physician supervision or to the extent they are authorized to do so under their scope of practice and any applicable state law by a non-physician practitioner. The test should be reasonable and necessary for diagnosing and treating specific conditions, which we will discuss shortly. If the patient is being monitored because they are currently on an FDA-approved osteoporosis drug therapy, the bone mass measurement should be performed with a dual energy X-ray absorptiometry system. Medicare will also cover a confirmatory BMM that is performed using a dual energy X-ray absorptiometry system, as long as the initial test was performed using a different technique. So let's go back to the presentation. Now, there are a couple of conditions for coverage that mention the beneficiary having a specific condition, so let's talk about that part of the coverage. First, we have women who have been treated for estrogen deficiency and are at clinical risk for osteoporosis. Not all women prescribed estrogen replacement therapy are going to meet this criteria. If a bone mass measurement test is ordered for a patient receiving therapy, the treating healthcare professional should document the patient's medical records as to why they believe the woman is estrogen deficient and at clinical risk for osteoporosis. Beneficiaries with vertebral abnormalities, which have been shown on an X-ray to be suggestive of osteoporosis, osteopenia, or vertebral fractures. An individual receiving or expecting to receive glucocorticoid therapy equivalent to an average of 5 milligrams of prednisone or greater per day for more than 3 months. Beneficiaries with primary hyperparathyroidism. And lastly, patients who are being monitored to assess the response or efficiency of an FDA-approved osteoporosis drug therapy. Now, there are some tests for BMM that are considered non-covered. A single and dual photon absorptiometry are not covered by Medicare as they are not considered reasonable and necessary. So now let's move on and talk about how to submit these claims to Medicare. Here's a list of the codes that can be billed. We have the 76977, which is for an ultrasound bone density measurement and interpretation. The 77078 is for computed tomography. 7708081 and 85 are for the dual energy X-ray absorptiometry and the G0130 is for a single X-ray absorptiometry. Now, there are some special instructions to avoid issues with ends for the National Correct Coding Initiative, or NCCI edits. Let me say that modifiers should only be applied if the clinical circumstances justify using them. And you never want to just add a modifier in order to bypass an edit. So if you are billing code 77085 and 77081 together in a claim, you're going to want to add modifier XU to the code 77081. If you're billing code 77080 and 77081 on the same claim, you're going to want to add modifier XU to code 77080. Now, on the resources slide, you will find a link to the NCCI procedure to procedure units. I do want to take you out there just in case somebody is unfamiliar with these tables. So they do have tables here for hospital, procedure to procedure edits, and also practitioner. I have looked at both of these and they do have similar information. I have already downloaded the hospital one, so we're going to take a look at that one because I don't want you to have to wait for downloads or anything like that. So before we search for the specific BMM codes, I would like to call your attention right here to the modifier column. This column is going to let you know if a modifier can be used that will allow the claim to bypass the NCCI procedure to procedure edits. So a 0 means that there are no modifiers that will allow you to use the code pair. When no modifiers are allowed, then only the code in column 1 will be considered for payment when billed, with the code in column 2 for the same patient on the same day. Now, if the modifier column contains a 1, then a modifier can be used with the procedure to procedure code pair as long as clinical circumstances justify the use. So let's take a look at the coding for the 77080. And it was suggesting that if you had with the 77081, which is this line right here, we can see that there is a 1 here. So we know that a modifier is allowed. Do the same thing. We'll scroll down to the 77085. And if we look at that with the 77081, it also has a 1 letting you know that a modifier is allowed and that you can bill those codes together. Now, the ZU modifier tells Medicare that these services are not typically bundled together, but in this case, both services are necessary and distinct. So let's go back. Now, I have provided a link for the most current list of applicable diagnosis codes that can be found at the Medicare Preventive Services Tool website. There are also some subcategory codes that can be used. I'm going to show you those a little later. It is a very extensive list. So if we click on this, you can see it's 11 pages long. So there is quite a few diagnosis codes that can be used for this test. Now, for providers who bill on a UB04 or an 837I, here are the types of bills that can be used to submit the BMM services. You are going to want to use revenue code 320. You can see there's a wide range of facilities that are allowed to bill for these services. Services can be billed once every 2 years, At least 23 months should have passed since the month following the last BMM test. So this means if the beneficiary received the service in January of 2024, then you're going to want to start counting those 23 months in February. So that means that the next time the beneficiary would be eligible is in January of 2026. Medicare will consider payment for more frequent BMMs when medically necessary. Some examples would be when the healthcare professional needs to monitor beneficiaries who are on long-term glucocorticoid therapy of more than 3 months, or if they are confirming baseline BMM is needed to allow for future monitoring. These are just some examples that are given by CMS. There may be other situations where more frequent monitoring would be considered medically necessary. Let's talk a little bit about how to determine if a beneficiary is eligible to receive the service so that you can avoid frequency denials. Now you have a few options when it comes to checking patient eligibility. We have the WPS Secure Net Access Portal, which is often referred to as the portal. Users must be registered with WPS to view beneficiaries' eligibility information. When you visit the WPS website, there is a box which takes up most of the screen. Here's where you can register, or you can log in if you already have an account. Direct data entry, or DDE, is an option for providers who bill using the Fiscal Intermediary Standard System, or FIS. This also requires you to register with WPS. Users will have access to Common Working File, which provides eligibility information for Medicare beneficiaries. The HIPAA Eligibility Transaction System, or HETS, is available for both Part A and Part B providers. The provider's access to eligibility is in a real-time environment. This option involves submitting files via electronic data interchange, so a trading partner agreement is required. Response files are accurate at the time of transaction and should not be interpreted as guarantee of payment. Now, for those of you who are registered for the WPS portal, there is a Preventive Services tab, which will provide a list of services and their next eligibility dates. I have provided a screenshot showing the bone density measurement information. You can see it provides a list of procedure codes with the next eligibility dates. Deductible and coinsurance do not apply to this service, so that would be 0. But this would be something that you can check to know if a beneficiary can receive the services. I did provide some resources where you can find information related to the BMM services. Now, the last one here is for the Medicare NCCI procedure to procedure edits. That's the one that we took a look at earlier. I would like to take you out to this first link just because I think it's something that's helpful regardless of what preventive service you're billing for. So if you go out here, you can see it has a list of all the preventive services that Medicare offers. The T's lets you know that these are telehealth eligible services. I'm going to click on the bone mass measurement. You can see here at the very top, right underneath the title, it does give you a link to the NCD. Over here to the right, it has a box that tells you if there's any information that's changed since in the last quarter. It lists all the procedure codes along with their description. Under the ICD-10 codes, here is the link that I provided for the diagnosis codes that could be used, but it also has down here that you could use the categories or subcategories, and it does give some examples that could be listed. So I just wanted to make sure that I pointed that out to you since I didn't list them specifically on my slide. It also lists coverage for beneficiaries, frequency, and if the patient would be responsible for any charges. Um, Now, the other notes section isn't something that you're going to find with every preventive service, but for the BMM, it does let you know about those instances where if you are reporting those codes together, you would need to use the XU modifier. It also lets you know that you should not report the 77080 with 77085 or 77086. Now, before I ask Jennifer if there's any questions that were entered in the chat, I did receive some pre-submitted questions. Just one moment here. Sorry about that. Um, so Jennifer I got some questions about documentation requirements. You would want to include the data the service was provided. It should be signed and dated by a physician or a qualified non-physician practitioner. They should be ordering it. Test results and any follow-up care or counseling that was given following the procedure or evaluations of the results. Documentation should also support the medical necessity of the service being performed. And you'll want to make sure that everything is dated and signed with the provider's credentials. Now, Jennifer did hold a webinar earlier this month regarding the clinical aspects and the documentation of bone density measurements. That encore is available on our encore webpage and on the WPS YouTube channel. So that's something that you'll definitely want to check out if you want more information on that. Another question that I got asked was about bone density coverage for men. So when we went over the criteria for beneficiaries, the only coverage that didn't apply to men was the first one, which was the estrogen deficient females. So everything else could apply to men. Someone else mentioned that they are receiving a lot of denials for this service. And since I don't have access to the system and I'm not exactly sure what specifically your claims are being denied for, I would encourage you to call customer service so that they can take a look at your claims and they could maybe help you determine what could be causing this. So hopefully they would be able to help you out with that. Now that was all the questions that I received during registration. So I'm going to ask Jennifer if anything has come through in the chat.
There is nothing in the chat right now.
Okay, thank you so much. We'll go ahead and move along then. Now, after the close of today's webinar, you will receive a thank you for attending email. Here's where you are going to find your certificate of achievement and contact hours for continuing education units. This email also contains a link which gives you another opportunity to provide feedback. If you did not get this email, please check your spam or junk folder. You will also need to add messenger@webex.com to your safe sender list to avoid any issues in the future. Now, if you joined only by phone, you will not receive this email. Please, in those cases, please send an email to the education mailbox with your name and phone number that you used to join so that a certificate could be sent to you. Now, if you do think of any questions after the webinar, you will have 7 days to send those in. You can send an email to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff will know that your question is related to this webinar and will send it directly to me. Remember, if your question is claim specific, please send those to customer services. They would be able to provide better information on why your claim's having an issue. Now, when you disconnect from this webinar, you will be redirected to a CMS survey. I'm also having Jennifer add a link into the chat, and your feedback really does mean a lot to us. We review what you have to say, and we really do our best to make the changes that you ask for. Now, this is also an opportunity for to let us know what topics you would like us to provide education on in the future. So please be specific. Please be specific if you have any ideas. Also, if you have ideas that you think would improve how you receive your education, be sure to let us know those too. Now, the redirect does look like what you see on the bottom here. We do not have any control over how this appears, so we just want to let you know that this is not spam. It's nothing malicious. You can just click on the continue button and it will take you to the survey. That brings us to the end of today's presentation. I apologize that I've had problems with my words today, but I really do thank you for being here. On behalf of myself, Jennifer, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.